working on over the last 6 months or so.
But this is just one event, and the numbers were this high.
Indeed. Although from about 2 years ago, we started screening in about 6 hospitals, and we were focusing mainly on cervical cancer. As you may be aware, the top 2 killers, cancers for women, is basically breast cancer and the cancer of the cervix.
Yes.
And we have been able to bring in some screening equipment that we have installed in about 6 hospitals in our county.
In fact, there is one thing about breast cancer, 34 per 100,000.
Indeed,
and for cervical, 25 per 100,000.
Indeed, which is very high, high. So for every 100,000 women, 34 of them have breast cancer. And like I said earlier on, most people, about 7 to 80% of them, seek care when they're in later stages, the advanced stages of the cancer.
And in fact, these statistics may have increased as of today, as of now.
Indeed, because as awareness increases, a number of people now get to be picked out, because people now know that you may not be having symptoms in the early forms, but actually you have one form or the other of cancer.
Do you have future events that are coming up that maybe we should be looking forward to, so that people can even come up? Because there are some who may be having suspicions concerning their status when their health status.
Yes. This week, actually tomorrow, we're having an event at our county referral hospital in Nyamira.
Okay.
We have organized a screening event. We are working together with partners including KBC, and we are basically going to be screening. This time we are going to be focusing on breast cancer, both for men and women, and also we are also going to be screening for other non-communicable conditions, diabetes and high blood pressure, and we'll also be screening for HIV. So it's going to be a massive event happening at the county referral hospital tomorrow.
At some more time?
From 8 a.m. in the morning. From 8 a.m. in the morning, we'll be there up to around 6 in the evening.
6?
Yes.
So make sure that you pop into the Nyamira County
Yes,
Referral
anybody
Hospital.
living within vicinity of Nyamira should head to Nyamira in the morning tomorrow to the county referral hospital. But other than the screening, with the kind support from KBC and Eda's Hope Foundation, Cancer Foundation, we are going to assist some cancer survivors with mastectomy bras. You know, mastectomy basically is the removal of the breast. You know, as a woman, when your breast is removed in a surgical procedure because of cancer, it can be sometimes very difficult to live with. If people are used to seeing you, and all of a sudden now they cannot see one breast, and sometimes you have both breasts removed because both of them can be affected by cancer.
So you'll be giving out this
to rehabilitate, to help in the rehabilitation status, and just to make sure that they live their normal life as cancer survivors. We've got kind donation from KBC and Eda's Cancer Foundation, and we are going to assist about 65 women with mastectomy bras. So far, we have worked with our community health workers, and we have been able to identify the women who are going to be beneficiaries of this donation, which is going to change their life fundamentally.
And these bras are for free?
Yes, they're for free. Indeed,
and normally,
they're for free.
How much do they cost?
Well, they are quite expensive, and other than the cost, even availability in the rural areas like where we live is very difficult. I mean, if you have had a procedure and you're from the village, your life just changes significantly. And these women we are going to help this time, their life is going to change forever. They are having their dignity back. They are going to have their life back, at least in some point.
There was a time that we had this event happening in Makueni County, and just as you had alluded earlier, KBC had partnered with the Eda's Hope Foundation, and people were given, the women, they were given the mastectomy bras. Many of them went home smiling.
Indeed, it's a great joy when you come to the hospital and you have no breast, and you walk back home and people look at you the way you are before and after. It is a very nice thing, and it changes even the dignity of that woman.
Do you have counseling services that will be offered tomorrow?
We do. We do. We'll be, alongside the team that will be doing the screening, we have a team of counselors that are going to be working with these survivors just to make sure that they're able to cope with, that trauma of having lost part of your body and having to get another renewed hope of living after surviving, a cancer.
Then how are you going to engage these women in a way that they can be able to understand how to use this mastectomy bras? Because maybe at some point, some may not be able to accept it. Some may have some stigma when it comes to receiving this mastectomy bras.
Correct. What we'll do first, when these people come, and we've already identified some of them, as we speak now, they are engaged with our counselors. They are trying to be spoken to, trying to be advised what mastectomy bras are, what their purpose is, how to take care of them, and that kind of stuff. So we are having a comprehensive program to make sure that it does not become an embarrassment to you again when you go back to the village, but you know exactly what's supposed to happen, how to take care of yourself, how to take care of the bra, and all the issues surrounding that. So there is a program for counseling, there's a program, and not just for tomorrow only. The people we have identified, we're going to work with them on a long term, because we have a group of counselors that we are working with in the department that's going to help them at least have better lives after tomorrow.
Then with regards now the Nyamira County now, let's focus now on the health sector of the county. Universal health coverage, how far is it when it comes to reaching Nyamira County? Because we recently had it being launched in Kisumu County, Makueni County has done it, Kitui County has done it.
Very well. As you have rightly put it, we have 4 counties in the country that are currently piloting the UHC. And as you may be understanding, UHC is a concept that globally has been agreed upon by the global community, and mainly because cost of healthcare has been escalating over the years.
And it's quite expensive.
Yes, and it is one of the areas that is contributing significantly to poverty, not just in our country, but also globally. And therefore, UHC basically means that everybody is able to access care of the right measurement and of the right quality whenever they need it, without worrying about getting impoverished.
All right.
So, and one of the best ways of doing this is to have people enrolled in prepayment schemes. As a county, from around 2013, a survey that was done by the Ministry of Health around that time showed that our penetration for health insurance was just about 17%, which is very low, meaning that the bulk of our population actually access care by paying cash, and that is very costly. So we are working around as a government and also with a number of our partners to scale up enrollments in the prepayment schemes, so that as we learn the new concepts that are coming up from the pilot counties, we prepare ourselves for readiness for rollout. So we are actually working with our local partners, including NHIF and other schemes, to increase enrollments in these prepayment schemes, so that people may have social protection when it comes to accessing healthcare. And at the same time, it's not just about being able to pay for the care, but also to be able to respond to the need that people who get sick may have. So as a result, we are also investing heavily in building health infrastructure, improving the services, introducing additional specialized services. Like now we are, over the last 3 years, we have introduced much more services. We are doing renal dialysis right now. We are also introducing intensive care services in the coming weeks or so. We are putting new facilities that are going to respond to the need that are generated by the public. And we are also focusing on strategic health facilities across the county that are going to make sure that people who come from the extreme corners of the county do not need to travel to the county referral hospital to seek care. So in our sub-county hospitals, last week we opened a theater in one of them, and we are going to open about 4 more theaters within the coming 3 or so months, so that surgical services can be accessed by our people wherever they are. We are bringing in more specialists. We are recruiting more doctors and more health workers to be able to respond to the need at whichever level. And more fundamentally, we are also investing in primary health care. And we have put a lot of emphasis on community health services. As a matter of fact, we are currently doing some legislation surrounding the issue of community health services to make sure that we are able to engage with the communities in more preventive measures in health, and to make sure that the cost of healthcare comes down if we focus more on prevention.
Now, when it comes to the cost of healthcare, and you mentioned something early on about NHIF. Many people complain about NHIF. How are you incorporating NHIF into these programs that you are having, even into the program of cancer?
NHIF over the last many years has been undergoing a lot of reforms, and as we speak now, the national government has identified NHIF as one of the vehicles through which we can achieve UHC in terms of catering for the cost of health care. As a county, we are also working on a formal arrangement with them. Indeed, part of the event that will be happening tomorrow will be having registrations for NHIF going on alongside the screening that will be happening in the County Referral Hospital. Right. So we are working with them to, like I said earlier on, the prepayments schemes like NHIF, to make sure that we have more people enrolled so that their cost of care is taken care of by the scheme.
How are you seeing Nyamira County being an example to other counties? Is it possible? Are you working towards that?
It is possible, because if you look at the penetration of health insurance, we are among the counties, perhaps around the 6 counties with the higher penetration. Although it's on average still quite low, but we are working around this. And we want to be an example, as you rightly say.
How are you going
we
to
are actually now working with some of the partners. I may not want to mention them now because we have not signed the MOUs yet. But one of the partners is going to help us with a solution to do registrations at household level. And another partner is going to help us with the training of the community health workers to be able to help us do household registration for NHIF at the community level. So we anticipate that once these agreements have been signed and we get on rolling, then we are going to cover, our target right now is to have about 80% of our population enrolled in the schemes and identify the people that are not able to pay so that the government can work around on how to assist that section of the population to be able to pay their premiums. And of course, there are people with the economic ability, and we will be encouraging these ones to be able to, enroll themselves and pay the premiums. Because actually at a cost of 6,000, for those who are members of NHIF, at a cost of 6,000 shillings a year, your family is able to access comprehensive health care.
6,000 shillings?
6,000, that's around 500 shillings a month.
Wow.
So you're able to access comprehensive health care. And the benefit package has been expanded so much over the last few years. And a number of conditions, including outpatient services right now, are covered by NHIF. So we're encouraging people to enroll and pay the premiums. And we'll be able to identify, during the registration process, we'll be able to identify people who will be having issues, the group we can call indigents that are not able to pay, so that we work around measures on how to assist this particular group.
What about the men? How are you going to incorporate men into these issues?
Men are the heads of the families. Indeed, as an African, we all know the position of the men in the households. And we are working with the entire family, including men and their spouses and all the rest. So we are not really segregating in terms of who to enroll, but we are looking at the family as a unit, both both spouses.
Because even with the men, we have prostate cancer,
yes,
esophageal cancer that is so rampant among the men.
Indeed. As a matter of fact, men, most of us do not seek care early, and most of us avoid seeking care in health facilities anyway. But we are trying to work on programs to make sure that they get involved in the health care of their families, and they're able to be example to their family members in terms of seeking health care. Yes.
I would like you to be part of this conversation. use the hashtag Good Morning Kenya on Twitter, at KBC Television, at Ram Aguko. The hashtag also KBC Afri Thursday. Now, when it comes to now being some cancer awareness in Nyamira County, there is an issue when it comes to examination. Is it possible for someone to be able to do self-examination even within their homes?
Yes, it is possible, especially for breast cancer. You can do self-examination, because once people are able to understand the signs and symptoms of breast cancer, then you should be able to do self-examination, especially for women. Just looking at the nipples, if you see anything unusual like a discharge or your nipple is looking inverted, if you touch your breast and you feel an unusual lump or unusual hardening of any part of the breast, those are alarm bells. It should be able to ring alarm bells that there's something happening in your breast, and you should be able to see a clinician to be able to examine and carry out tests. So it is possible to do self-examination. It is possible also to be able to palpate yourself. Just touch, and you'll be able to feel anything unusual. And this can be a pointer that something is happening unusually within your body, and you're able to seek health care.
All right. Yeah. Now, as you wrap things up, maybe I would like to give you the opportunity to maybe pass a message to the Kenyans concerning this cancer awareness event, and also concerning the message towards healthcare.
Thank you. To the fellow Kenyans, cancer has become a menace in our country. In fact, right now, it's among the top killers of our people. But the good news is that cancer is preventable, and if picked in early forms, treatments are available locally, and you can have full recovery when you have cancer picked in the early forms and you seek health care. The key to this is to make sure that you deal with the risk factors. Some of the risk factors that are associated with cancer include consumption of alcohol, consumption of tobacco products, that is basically smoking and other forms of tobacco use. Age, as you age, age is a risk factor. When you reach your fourth decade, when you hit 40 years, it is important that you go for annual screening, not just for breast cancer, but for all other forms of cancers. For the men, if you are already 40 years, make it a routine that every year you go for screening for prostate cancer. Many health facilities across the country are able to do a screening for prostate cancer. And so that early screening actually may be a game changer for all of us.
In connection with that, how young can you be, someone like my age, should I go for cancer screening? Someone who is even within the age of primary school, high school, campus?
Well, most of the cancers, like I said, age is a risk factor. So the older you get, the higher the probability of getting cancer. But we do recommend that when you get to 40 years, if you're a man, you should be having your annual screenings for prostate cancer.
And for the young people, we don't have, there's no alarm for the young people.
Well, cancer can happen at any age, but like I said, the risk factors in the probability increases as you age. So when you get to 40, please make it a routine, annual screening. For women also, if you get to 40, make it an annual screening for your breast and also for cervical cancer. And that may actually save more lives than waiting to go to treatment centers.
Thank you very much, Dr. Jack Magara. That is the acting Chief Officer of Health Services in Nyamira County, for joining me this morning. Now, did you know that cancer is the third highest leading cause of death in this country, in Kenya? cancer, and that it estimates that around more than 40,000 new cases of cancer occur each year in this country. That is according to statistics. So make sure that you head over, if at all you're within the vicinity of Nyamira County, to the Nyamira County Hospital.
Yes, Nyamira County Referral Hospital for tomorrow. But for the rest of the days, we are doing screening for cervical cancer in our hospital in Manga. We are doing so in our hospital in Ekarenyo. We are doing so in our hospital in Kijauri. We are doing so in our hospital in Nyamusi and also in Karoka. Wow. So for cervical cancer, these are centers that you can visit any time of the week routinely to have yourself screened. We have some equipment there for management of the early forms of cervical cancer in those centers. But for the rest of the day tomorrow, we'll be in Nyamira County Referral Hospital, where we'll be doing screening for breast cancer and other forms of cancer, and also doing enrollment for NHIF. We'll be doing registrations for NHIF. We have talked with their team, they'll be there with us. We'll also be having screening for the other conditions, diabetes and high blood pressure. And also, more importantly, we'll also be doing screening for HIV.
So make sure that you head over there, right? Wherever you are, make sure that you head over to Nyamira County Referral Hospital. You can get all these services. Remember, KBC has partnered with Eda's Hope Foundation, and together we are giving a smile to all the cancer survivors. Mastectomy bras will be provided for free. You will receive cancer screening for free. All this tomorrow at Nyamira County Referral Hospital. Now, Dr. It's Afri Thursday.
Yes.
Well, when it comes to African music, who are your favorite musicians or favorite artists? What's your favorite?
Well, Ram, there are many, but Madilu is on top of the log. So
Madilu system.
Yeah,
you
indeed.
like rumba?
I do.
Thank you very much. Looking forward to discussing more with you, and I wish you well when it comes to the cancer awareness tomorrow.
Thank you very much.